once you have a great command, and when I'm going to use that word and that terminology, great command of anatomy, you can figure out anything. But if you're just thinking about structures and you're just treating literally blind, you're going to end up getting slower results, and your patients are going to recognize that.
Who felt that their education was adequate in delivering accurate and valuable information about the foot and ankle? Just show of hands. Ooh, I like it. You're in the right place.
This is how we were taught, correct? We were taught in layers.
What is the goal of what we do? I will give you a hint. The answer is the same for everybody.
As manual medicine clinicians, our goal is to modulate the sympathetic nervous system. I want to send more input in there. I want to send as much input in there as possible. On the flip side, if it was hypertonic, I would want to turn it down. Modulate or communicate, talk, influence, intervention, whatever word you want to put in front of it, that's our goal. Those two muscles that are of the intrinsic foot muscles have direct attachment into those tendons, which means what? It affects it.
This is not a wrong way of learning. Like, it is important to know all of these structures and where they are and how they interact, but all of these that we're looking on the screen, they're all innervated by the same nerve. So if you could just take a step back and think about how can I influence the tibial nerve, then you have influenced all of these muscles.
The way that we are going to teach our anatomy within our course is we're going to start with the nerves. This will allow you to make sure that you affect the structures that you are trying to treat. We need to understand how an injury happens. Injuries happen simply because the load is greater than the capacity. It does not matter what type of tissue it is. If the load cannot be managed, we're going to have an injury. We cannot prevent injury. There is no exercise, there's no magic potion, there's no stretch, there's no therapy, there's no acupuncture protocol that will tell the tissue don't get injured. We want to be able to get the capacity of the tissue to withstand any load, and the best way to do that is by increasing the capacity. It's only when we build up the amount of capacity for the tissue where we can really limit the amount of stress. And the best way to do that is maintaining the amount of tension on the tissue.